everybody. Welcome. This is Veronica Hunter, your hostess of the Facebook group Child with ADHD, What Now? And today I'm delighted to introduce to you Dr. Erina, who is coming on to answer the questions that you posted inside of the group. So on Mondays, we drop a Q&A thread, and you can go there and post your questions. And then later in the week, we come in and answer those. So delighted to have Dr. Erina here. I met her first because she wrote this article on anxiety that was incredibly, I found accurate to my experience and insightful. And so then I met with her, interviewed her for our YouTube channel as well. You can find out more about her there, but also then invited her to be a regular part of the community here with you, because she offers services too that I think are really relevant to this group here also. So we'll be telling you more about that at the end and how you can get in touch with her deeply or get to interact with her further. So Dr. Erina, thank you for being here.
Thank you for having me.
Yay. But tell everybody really quickly what you do, so that, because I didn't share that part. Like, you are a
Sure. I wear many hats. I am a clinician, a therapist, psychotherapist in private practice. And I also I'm on the faculty at the Harvard Medical School and at UNH in their graduate social work program. And I do some research, primarily at children's and primarily with children who have self-harm and suicidal thoughts and behaviors. And I more recently founded a company called You Have a Village for parents who have kids who have mental health needs or some behaviors that they're struggling with. I did this because for two reasons. One, in my last startup, I worked with parents around the globe who had kids with ADHD who were using biofeedback. And every single time I got on the phone to ask them how they were doing, they would burst into tears. And they'd say, I feel so alone. I feel like I have no one to talk to. I don't want to out my kid about their behaviors, but I have nowhere to go. So You Have a Village is a place for parents to come and get support through groups. And all of the groups are moderated by myself or clinicians who have a lot of experience in this field. So parents can feel like they're not alone and they do have a place to go to. I think I do other things too. Oh, I'm a mom. That's probably should be at the first of the list. And I wrote a children's book. I have I do many things, but those are probably the primary ones for now.
Awesome. Thank you. So great experience. So we know that you're going to share something very useful and relevant.
I hope so.
Let's get into some of the questions then that were asked. And we'll do as much as we can in about 10 minutes or so. So first question, how to teach a 6-year-old to notice when they're being overstimulated or to take a break and to use a calming activity?
It's a great question. I would have some questions back for the parent who posted this, but I would say generally, I would try to break it into 3 steps. So a 6-year-old that's overstimulated, I would ask the parent, what does that mean? What does overstimulated tend to look like for them? And why is that a problem? Because if it's not a problem, then maybe it's not worth spending a lot of time working on it. But if it is a problem, I think that the first step I would work on, so I would break it into 1, identifying what overstimulated means both for the parent and for the kid. And so that might take a little while. Like, what does overstimulated look like? What does it mean? And the second one is what to do about it. And then the third one is what triggers it. So I would, if you begin to sort of understand what overstimulated is, I would slowly begin, and this could take months, I would slowly begin to sort of say, okay, in my mind, mom, this is the overstimulated behavior. And then I would slowly introduce that to the child. So, It looks like you are having a rough time, or, oh, it looks like you have a lot of big emotions right now, or, oh, it looks like you have a lot of energy right now. And I would use a couple of key phrases that look the same and mean the same every time the child has that behavior. And then I would start to say, let's calm our bodies. Let's try this. And over time, if you use that, okay, here's the phrase that means overstimulated, and you use it the same way every single time. And then here's the phrase for what you do when you have, an overstimulated body. And then over time, if you keep that very consistent, the child will begin to understand, oh, this is what my body looks like when I am overstimulated. This is what I can do about it. And then the third step, which I think is hard, and it really should be the first step, but it takes time to get to it, is the understanding the trigger. So sometimes you can even say to the child over time, you realize, oh, you have a busy body, you have a stimulated body. This is what we do about it. I wonder if that's because you ate a lot of sugar, or I wonder if that's because you had a bad day, or I wonder if that's because the play date is over. And so then they begin to realize, okay, this is the trigger, this is the behavior, this is what I do about it. This is not a process that happens in a weekend. This may take years, but just having consistent language, interpreting it in a very non-judgmental, non-upset, because we all get emotional too as parents, way over and over and over again, and then having the same language. This is what is happening in your body. This is what we can do about it. And, oh, this is maybe why. Over time, kids it becomes part of their vernacular.
Awesome. Thank you. Next question. How to tell the difference between lack of motivation due to depression versus lack of motivation due to ADHD and executive function challenges? Is the treatment different depending on where the lack of motivation comes from?
Yeah, this is really tricky. And I think this is a really good question. So whoever posed this, bravo. I struggle with this personally in my practice all the time. So I would ask this parent how old their child is, because there's a lot of differences in treatment and recognition of depression based off of their developmental stage. But I think the first step for me as a therapist, and then I would say that's probably translates to parents as well, is to really understand when the depression seems most apparent. So if a child is happy all summer long and then gets to school and you notice that they're really struggling, then that might be a bell, like this depression is related to schoolwork. If the child seems really content and happy on the weekend and struggles during the week, that might be a bell that the depression is related to academics or schoolwork or ADHD versus a biological base. This can take time. And the treatment is different because obviously the school is the trigger. So if you relieve the school or make things feel better at school, then the depression should hopefully begin to moderate or ameliorate. So I think these are great. This is a really great question. I think it takes time. I think it takes some deductive sort of reasoning. And I think the tricky thing is that the sooner you begin to get on top of this, the better, because, and this may be where this parent is coming from, if you let it go too long, sometimes the depression that's related to academics can actually turn into sort of more of a I'm bad, I'm not good, more of a bio-based confidence depression. And then it becomes a vicious circle, which is what I see a lot in my late teens, adolescent, college aged kids, is that it becomes really difficult to separate out the two forms of depression when it's been ongoing for so long that the kid feels depressed because of schoolwork and they feel like they can't do it. The more depressed they get, the worse they do in school. The worse they do in school, the more depressed they get. And then it becomes really difficult to untangle the two. So it's a really good question and very important to start to pick up on the younger they are.
Amazing. Thank you. And switching gears a little bit, what is the best therapy for ODD and ADHD for a young child to ensure that ODD doesn't turn into delinquent behavior as a teen or adult?
So I really struggle with giving kids a diagnosis of ODD at 7. And so again, I would love to ask some questions to this parent. I think the reason is that it is developmentally really hard to, I don't know, a lot of kids have a lot of things going on in their bodies and in their brains when they're developing at 7. And ODD can be a pretty pathologizing diagnosis, and not one that I would want to wear around my neck starting at age 7. That said, if that's where, what your providers have given for a diagnosis, I still would probably tend to focus less on the diagnosis and more on the behaviors. So I would say, what's the problem? What's the behavior that makes you think that your kid has ODD? And what's the behavior that makes you think your kid has ADHD? And how can we tackle helping your child with those behaviors? And then I think that gets at the second part of the question, which is not allowing them turn into delinquency as teens and adults. Really starts with how much power you give them as kids, as young kids, to work on themselves. So I would say, I don't know exactly what this kiddo looks like, but let's say they're hitting their sibling, or they're, destroying property at school. And so they've been given this label. I would just spend a lot of time, as if I was their therapist, on what triggers them, sort of similar to the prior question, what's triggering them, what the behavior looks like, and what they can specifically do to stop the behavior. And I would work on it, try to be as consistent as I can, both at home, at school, with a therapy. Everybody's on the same page about what happens, why it happens, and what you can do to fix it. And it may take some time. I mean, none of these things go away overnight, but I think with just real kind, sort of compassionate, this is the behavior, this is what we should do about it, this is what we're going to do about it, this is what would look like moving the needle. Has the needle moved? Is what we're doing working? If it's not, let's try something else. This could take a couple of years. That I think would really help them a lot to prevent them having more destructive delinquent behaviors as older adolescents.
That makes sense. And it sounds like the context of the conversation is a very collaborative type of approach too.
I think so. I think kids' brains, I have never met a 7-year-old that's a bad kid. I just don't think kids are bad. Like, I've never met one. So I try to have that in my mind always, that this kid isn't a bad kid. This kid's doing maybe some bad things. So how can we help them make different choices? And then that's our job. That's the adult's job around them to help them with that. And I would say if your providers don't have that frame of mind, see your kid as a good kid doing bad behaviors, and they're not willing to sort of work on that, maybe it's time for a different provider.
Mm-hmm. Mm-hmm. Thank you. And then one last question, if you would, how should parents address hoarding behaviors? Like, this is something that can potentially go along with ADHD that might be not really discussed often.
Yeah. I again would ask questions about the child's age and what, hoarding behavior looks like. It's really developmentally tricky because, kids collect things. All kids collect things. And sometimes it looks like they're hoarding. And so there's a big sort of continuum about what that looks like. I think when people are adults, we have a really clear definition and interpretation of what hoarding is. I might be careful as a parent of a young kid to pathologize that behavior, just because they might just be really curious and they might be wanting to collect things. And so I would probably start with just, oh, what did you bring home? Tell me more about this. Why are you interested in this? Like, explain more, and just try to use as much of a curiosity perspective and stance as I could, and not make them feel bad or judged for doing it, because who knows, maybe they turn into Darwin or something and start collecting, collecting all kinds of species and different science aspects. Maybe you're working with a baby scientist. I think I don't really think of hoarding as hoarding when they're little. And I guess if it's a big problem and it's impacting their functioning or impacting your house, you could begin to sort of say, okay, let's figure out where we're going to put all this collection, or let's really talk about, like, do you need all these things? But I'm not so sure I would make a big deal of it when they're little.
Awesome. Thank you. Very good.
Yeah.
So there's been a few key themes that I came across in almost all of your answers. I feel like some of the curiosity, being curiosity based, figuring out what's really going on for the kids, and being really supportive of their the goodness that it kind of lies underneath that, and they are trying their best. So thank you so much for sharing that. And your empathy is, I just really appreciate it. So thank you for bringing that also. The place where people can find you online if they want to learn more about you, and especially the village that you have created, because I think that's a wonderful resource available to people and to feel connected and feel supported. Can you share where people can find that, please?
Sure. So my personal website is erinawhite.com, which is ERINAWHIT.com. And some of the articles that you were talking about are on there if anyone is interested in some of those about ADHD and whatnot. And then my village website is www.youhaveavillage.com. And that is, you can join the village there. And we also have lots of resources for parents. Some of the tips that we talked about today, many blogs from other parents like you who are struggling with similar things. Lots of resources on that page, as well as a way to join if you want.
Awesome. Thank you so much for being here, Dr. Erina.
Yes, thank you so much for having me. And all of you, thank you for your great questions. I'm delighted to have the opportunity to answer them.
Awesome. And if you're listening, pop in below, what stood out to you? Like, what was your big takeaway from having listened to this today?